Fabulous. Now, the message that says that this is now recorded. Welcome to our Health Science Lunch and Learn. This morning we have Barbara Burt and Melissa Leeds, both in the Department of Office and Career Technology, to speak about health science education programs as they are consultants for this area. My name is Amy Schrader, and with me also Dr. Elizabeth Sandifer. We are both career development work-based learning consultants supporting CDCs. And Dr. Keisha Bryant, school counseling consultant supporting school counselors. Again, thank you for your patience with the technology challenges this morning. I'm going to pass it on to Barbara.
Good morning, everyone. I am Barbara Burt. I'm going to tell you a little bit about myself. I am an RN with 40 plus years of various nursing experience. I've been at DPI going on 8 years as the one of the health science consultants. And I just want to let you know I love my job. It's the best job I've ever had. So I will let Melissa introduce herself. Melissa, we can't hear you. Are you unmuted? Okay. Technology is not our friend today. Melissa is the newest consultant. Today is her 6th day, I believe. She did come from as a teacher in health science from one of the PSUs. And I know Melissa has 20 years of nursing experience, and she is also an EMT. So we'll go ahead and get started. This is the attendance check-in. So if you'll take a minute to check in so you can receive the credit for this presentation, for this time that we have together.
This is also a link provided in the chat.
Thank you, Amy. A couple housekeeping. We are talking about North Carolina CTE curriculum program areas. This is a live session. You earn your CEUs, point 1. And you'll be able to get it from your NACE's transcript. And then we have a part 2 where you do have to check out at the end, and we'll show you that as well. Again, all sessions are recorded and they're shared to the CDCs on the Moodle. This is a form that you can use for any questions that you may have. Amy will monitor this and send it to me and Melissa. Also, if you have questions during the presentation, you can enter them in the chat. Amy is monitoring that as well, and I think Keisha is too. So this is the list of the health science education classes that is offered through DPI. Melissa, do you have sound yet?
Barbara, I hope I have sound.
You do. Okay, I'll let you, if you want to tell them more about yourself, and also if you would tell them about your courses that we are working you towards.
Whew. This has been an adventure. So I have EMT experience, which Barbara talked about. I also come from nursing, 20 years of nursing experience, and I've been a teacher in the classroom for 11 years. So I just left teaching 6 days ago. I officially started with DPI, so I'm 6 days in. So I'm the new baby. I'm really excited to be a part of this team and to help grow health science education. But I am only 6 days in, so I have not taught all of the curriculum that I will be looking at. So I will be reaching out for some help. But biomedical technology Foundations of Health Science, Health Science 1, Health Science 2. Barbara, everything is really small for me.
Pharmacy
I know
technician.
that I project lead the way.
Mm-hmm.
So I have a lot that is actually sitting on my plate.
Melissa can handle it.
Melissa will learn.
Yes, we'll do it together. So I have the nursing courses, which includes nursing fundamentals and non-practicum, nursing fundamentals and practicum, your fundamentals of gerontology, and public health fundamentals. So let's talk about our pathways. Before we do that, I want to talk about the course management system, CMS, which you may hear us say a lot. This is where you can find your course information, the course blueprint, and career pathways specifically about health science courses. And there are many other things you can also get out of the CMS system. So I'm going to start with the biomedical technology pathway. A couple of things you need to know is that we have added HP71 Project Lead the Way Human Body Systems as a prerequisite option. So if you have students that are in taking Project Lead the Way and want to advance into other courses, they are still able to do that because we have now added it to the pathway. Also in the biomedical technology pathway, we have for our career pathway majors, I wanted to point out pharmacy tech, and then we also have apprenticeships. We have supplemental courses, which is HU10 Foundations of Health Science. We also have work-based learning experiences, business and industry field trips, job shadowing, and apprenticeship. And I'm going to talk about that a little bit further as we go through the other pathways. And again, HOSA is our CTSO, our intercurriculum and technical student organization. Our next pathway, which is our biggest one, is the healthcare professional, HPCP. And again, we have added HP71 Project Lead the Way Human Body Systems as a prerequisite. So students can take either one and still be in the pathway, meaning Health Science 1. Basically, those two classes are it's basically anatomy and physiology. Health Science 2 is the concentrator in this pathway. And this pathway leads to our career pathway major options, which is, again, pharmacy tech. We have our nursing courses in this pathway, and then apprenticeships. Then your supplemental courses that you need to know about is HU10 Foundation of Health Science. We added IP21 Emergency Medical Technology. What we found was that many students are in the health science pathway, but don't necessarily want to, once they take health science, to actually have no interest in being a pharmacy tech or being a nurse. So, but a lot of them may have interest in the EMT portion of it. So we added that after talking to the public safety consultant and working with him, collaborating, and felt like it'd be a good fit. Now, Project Lead the Way pathway is just what it says. There are 4 courses that are actually part of Project Lead the Way. And this is pathway that is taught. The teachers are trained by the Project Lead the Way and representatives that go to training and everything, but they can still go through the same, if they're in that pathway and want to take our career pathway majors, as was shown on the previous pathway, they can still do it by being in the Project Lead the Way as well. So I also wanted to talk about the fact that we are trying to encourage the health science teachers to look at doing pre-apprenticeships with our students, and I'll talk about it further. So there's always been issues about what are the health science proof of learning. HU10 is the CTE assessment. HU40 has the assessment. HN42 nursing fundamentals and non-practicum. There are a lot of questions on that. There's a CTE post-assessment tied to that. The only PBM that we have in health science is in HU 42 Health Science 2. Nurse aid, HN 43 is hands-on. It is not a job shadowing. The students learn the skills, they practice them in the lab, and they actually go to, and they're required to go to clinical, which is 40 hours to at minimum, to actually apply nursing skills to their patients or residents. The credential is nurse aid certification, but it is done by a third party, and that is credential. That third party administers the written and the skills portion of the exam. Now, fundamentals of gerontology, HN 44 and HN 45 public health fundamentals. This is these two are courses in which students get credit for them, but they don't earn a credential. They are not standalone courses. Bottom line is the students have to have the Nurse A1 certification in order to use this. And I'm gonna let Melissa talk about this a bit more because she's actually seen this happen in the school system.
Hopefully you can still hear me.
Yes, we can.
So one of the things that I have seen, and I'm a very transparent person, is students have a hole in their schedule and they say they want to go into health sciences. They want to go into a career path. And a lot of schools will put a student into a public health fundamentals course, which is what my experience was, but that student has no desire to be a nurse aide. So that doesn't go together. So as my analogy to Barbara was, if you think about getting your driver's license and then you decide you want to drive a motorcycle, you get what's called an endorsement to your driver's license. You don't get a separate driver's license to drive the motorcycle. So if you think about HN 44 and HN 45 as that endorsement, it is the endorsement course that attaches to that nurse aid. What does that do for the student? So I know I still work PRN for Duke, which is as needed. Our nurse aid students, if they have that endorsement, it helps them to work in home health. So it gives them a little bit of a leg up, but it doesn't give them a standalone path to work. So they go hand in hand and it's an endorsement to each other.
Very good. Basically, the nurse aid, you cannot have the public health or the gerontology without having the nurse aid. That's it, bottom line. Other proof of learning in the biomed technology is the CTE post-assessment. Pharmacy tech is credential. That is also a third-party assessment. Then we have the Project Lead the Way courses, which they are local courses and a third-party assessment. We always get questions about what courses are aligned to the credentials. We have some credentials, and it's very hard for me to say this because as a healthcare provider, all of these credentials are of value. But I know in the education world, you may not necessarily see the value of them. First aid aligns with HU 40 and Project Lead the Way. Stop the Bleed aligns with Health Science 2, HU 42, and Project Lead the Way. And Melissa, tell them what you've been doing with Stop the Bleed, that you've been our instructor.
So Stop the Bleed is not a hard course to do. And to be really honest, we all know what just happened in Virginia where a 6-year-old shot a teacher.
Mhm.
So for me, as an EMT and a nurse, it's important that we teach this course. To become an instructor, all you have to do is go onto their website, take a virtual training through Stop the Bleed, and then come to a class where you show skill. That skill is how do you pack a wound and how do you apply a tourniquet. It takes less than 30 minutes to learn those skills and become a stop the bleed instructor. And if you think about all the students that we touch, if we could teach them how to stop bleeding, it saves lives. So for me, it is a credential that's more than just a value credential. It is not hard to teach. The students feel very successful. Unlike the BLS courses, which take hours, this takes about an hour or less. So it's very easy to do. I do teach it at summer conference, or I did. I don't know that I'll be able to this year, but I'm sure we will have it again. But again, it takes very minimal time to become an instructor.
Okay. And it takes very little time to save a life. Again, we have all the other courses listed. I'm not going to read them out to you. Geriatric and home health care, which is the public health fundamentals, is an endorsement. So let's talk about some of our program areas. A lot of the counselors, you guys are involved in HN42 nursing fundamentals and non-practical. And I wanted to include this one specifically because I don't think a lot of people understand it. The background of this specific course is that when I came to DPI in 2015, I noticed that students were not necessarily meeting the requirements, but were receiving a grade for the nurse aid training class. They didn't sit for the exam, but on their final transcript, it showed that they took the class. So this information got back to our regulatory agency, DHSR, and I was informed that we needed to make this change because that couldn't happen. So we developed the HN42 Nursing Fundamentals and Practicum. We changed the name, which was just plain Nursing Fundamentals. The reason we use the terminology of practicum is because universities and community colleges, when you look at their nursing courses, you will see practicum. That notes to them that the students did clinical. They went to a clinical site, learned everything in the classroom setting, did the training in the lab, and then they had to go to the clinical site and actually demonstrate, show that skill on a live client or live patient. So what we did was we developed HN42, and the course requirements for nursing fundamentals is that you have to demonstrate proficiency in the curriculum skills, and you have to successfully complete 40 hours of clinical, 40 hours being the minimum. So we got together a group of students. We wanted to make it co-curriculum with HOSA. This particular class is still an honors course. They get the same credit hours. The difference is if they cannot meet the course requirements, which I just listed, then they have not completed a Nurse Aid 1 training course. So we develop projects that the teachers will assign. What we've done in this particular class, we implemented it school year 2019-20. And some of you remember what happened with the pandemic. A number of the students were actually shifted to nursing fundamentals and non-practicum. Some of you did begin your school year of 2021 with them in this particular course because it actually teaches the same standards 1 through 6 as nursing fundamentals and practicum. The difference is the clinical portion. In non-practicum, the students apply it to a special project, the skills and their knowledge. In nursing fundamentals practicum, they actually apply it to a live client. So this course was used a lot during the pandemic. Students still got credit for the course, but no certifications. So a couple of things that changed last school year, and I discussed it at summer conference after talking to a lot of CTE directors. Teachers must discuss potential transfers to HN42 with the principal and CTE director. They already know when a student I mean, you can tell that the student's not going to become proficient in their curriculum skills. If they can't master them in the lab, on a dummy, or even with another student taking vital signs is so critical for a patient. If they can't master that, they cannot go to clinical.
So, Barbara, can I add, just coming from the school system, a lot of students are put in one course or the other, and we need to make it clear that this is fluid. So a student starts in the practicum section, and then they're 2 months in, and either the student or the instructor in the room realize that the student's not going to become proficient in curriculum skills, or the student can decide, I don't want to go to clinicals and lay my hands on people. This isn't what I want to do. That's fluid, so they can move from one to the other during the semester.
Yes, that is correct. Again, these students have to take the CTE post-assessment. And I'm going to go over a form, which is my next slide, that once the teacher has discussed with the principal and the CTE director that the best option for the student is to transfer them to HM42. And they are transferred for many different reasons. And generally, the main one is that they're just not proficient in their curriculum skills. They could have a medical condition that prevents the student from safely providing hands-on care to another individual. An example of that, you may have a top A student that's doing well in all of the curriculum skills, proficient, but they could all of a sudden have to have surgery or they broke their arm. You cannot provide patient care to someone with a broken arm. It just can't happen. So that's an example. A lot of times those happen like maybe a week before clinical or 2 weeks before clinical. This is unexpected, but this gives that student an opportunity to get a grade for that class. If this happens at a community college, you're in their program, a nurse aid training program, you're automatically out. You don't have any opportunities at all to provide the information. You have to get kicked out of the program and have to reapply or again once you're healthy. If the student can't meet industry requirements, they can't meet the immunizations, the criminal background checks if you're doing them, drug screen tests, so that the industry requirements are based on what the clinical site requests. Some clinical sites, especially long-term care, may not want a background check, and that's fine. Or they may not want a TB test or drug screen test. However, many of them will want the immunizations. And the most recent one, hot button one, is COVID. This is a federal mandate. Any hospital, long-term care, any healthcare agency, that also includes public health. If you are at doing home care, employees, students, anybody that has hands-on contact with a patient, resident, client, whatever you want to call them, must take the COVID vaccine if that agency is receiving Medicare or Medicaid payments. They may be some long-term care facilities that are private, that they're, are not receiving Medicare or Medicaid payments, and they don't have to mandate this. But it's a federal law, it's a requirement. And we also need to think about the safety issues for our students and our clients and residents. Now, I know some of the counselors are going to say, oh, she's got pregnancy up here. Well, whenever students are young, I mean, we're talking about young people having babies, but the reality of it is that we as nurses, we work all through our pregnancies. We do everything that we've always done. But bottom line is, no nurse should or never moves a patient by themselves. They always get assistance. And that's what balances the weight. So I have on the Nurse Aid Moodle information about how a student and parents can work through a pregnancy. First of all, the physician has to be involved. They need to know that this student is going to take the class and what it involves. They'll be in a clinical site. And they may say, well, they can't, and this happens a lot in the hospital. The first 3 months, they have to stay away from certain diagnoses with certain patients because of the possibility of something being transmitted to the baby. Or they may say the person or the student can't physically do it. So you have to involve the physician, and the parents and the students have to be involved in the decision. So if you have a student that really wants to do this, that's not a problem. They still can continue in the clinical site. Now let's talk about behaviors. Students that exhibit behaviors that will not be conducive in a patient care area or setting and would jeopardize patient safety. When you are working with clients, particularly in long-term care, I'm gonna tell you right now, these old folks, they don't bite their tongues. They do not. If students say things to them that would be offensive, or even if the student's behavior would jeopardize that safety. For example, if you have a student that constantly does things that are contraindicated in a healthcare setting, that's not providing safety. If they forget, if they can't remember things such as giving a call bell to a client, or they just walk out the room and leave them sitting there when they're not supposed to. Those are the things, those are the type of behaviors, or if they're yelling and screaming down the hall, those are behaviors that could jeopardize a client or resident. I got a call one year from a teacher telling me that her student just got on the floor and just started kicking and screaming. Can't do that. That's just not appropriate. That's where we used COVID as a reason. And I'm going to tell you guys, if your students are in a long-term care facility, you have to follow their rules with COVID. If one student gets COVID, and this has happened this school year, happened in the fall, the administrator or the chief nursing officer or director of nursing will ask you to leave. Because again, you can't jeopardize the patients. So what's happening this year is I'm talking to individual teachers, CDCs, CIMCs, CTE directors on how to handle specific cases. We still have the option of scenario driven for clinical as well. The other thing that is important, before you transfer a patient from nursing fundamentals practicum to HN42 nursing fundamentals and non-practicum, those grades have to be copied. So the teacher literally has to write them down somewhere, and because she's gonna have to put them back into 42, because standard 1 through 6, they've already gotten a grade for that. Those grades still count. It's just that standard 7 is different. And I'm sure if you have any questions, just put them in the chat. So I like to call this open the door for opportunity. One of the things we have been found out in health science that teachers wasn't always using all of their opportunities. During the summer, at summer conference, we came up with the idea of how can we help teachers to see what opportunities are out there for them. So what we did was we had different speakers from across the state, hospitals represented, different agencies at our opening ceremony. And we talked about the opportunities that they had and gave each of the presenters opportunities for the teachers to go and talk to them. We want the teachers to offer job shadowing experiences. We want the schools to partner with different industries. When you look at biomed, there's pharmaceutical companies. There's other companies that could partner with that offer biomed. We have our pre-nursing apprenticeship, which is an awesome opportunity. We are working, as soon as we can get Melissa up to speed, on our second pre-apprenticeship that will involve the courses from Health Science 2, and also pharmacy tech, again, biomed, providing opportunities for those students. and of course your work-based learning. Healthcare is booming. There are lots of opportunities, and it's just a matter of finding the right partnership. So there's a couple of key points I want to mention. Again, Nursing Fundamentals and Practicum does have a class enrollment limit of 10, and that is per the North Carolina Board of Nursing and DHSR, and this has to do with 1 RN teacher per 10 students. Just as a reminder, this is hands-on. So the students have to know the skills before they go in, and as well as in the clinical site. There's an age recommendation from the North Carolina Board of Nursing, which is 16 and a half, that the student sits in that seat for nursing fundamentals, they should be 16 and a half. This has to do with the fact that this is a credential that expires within 2 years. The credential, and within 2 years of the student completing the class, not obtaining the certification. The student has to work for 8 hours within that 2-year period for pay in order to renew their certification. There is no cost for the student to renew. It is the renewal of the certification is free. HU10 Health Science 2, the prerequisite is the prerequisite for Nursing Fundamentals and Practicum. And I'm gonna let Melissa talk about this one because I love the way she talks about it.
So I want to go back to the age recommendation and just reiterate what Barbara said. 16 and a half is the recommendation because the student has to recertify that credential, and they have to, it's 2 years, the credential is good for 2 years, and they have to work 8 hours. There is no specific grade requirement for HU42, which is that Health Science 2. So a student could make a D and actually go into nursing fundamentals. I will tell you, you will get pushback from your nursing fundamentals teacher. I will say that. So the other thing that Barbara and I have talked about is that word prerequisite. So people get confused with that word prerequisite. We all know that means it has to come before. It is not a co-requisite. So students cannot take HU42 Health Science 2 at the same time that they're taking Nursing Fundamentals and Practicum. So it has to come before the course.
And we are actually preparing our students for their post-secondary work if they're going into healthcare. In healthcare, everything is a prerequisite. It builds on it for the courses. For us, Health Science 2, that is where the students learn their CPR and get certification, not in nursing fundamentals. We have made some concessions due to the pandemic because, none of the training programs were open. So now we're beginning to see them open, but we have students that didn't get CPR in Health Science 2. And I've approved for them to take CPR that the teachers can offer. CPR is not part of Nursing Fundamentals curriculum. So let's talk about the career outlook for health science. Everything you see on this screen is already outdated, I guarantee you. And a lot of that has to do with the pandemic. And I don't have nursing on top because this is my belief. Everybody can't be a nurse and shouldn't be a nurse. Just because the child says, I want to be a nurse, that don't mean that this is the career for them. So there are so many fields in healthcare. For example, clinical laboratory technologists. I'm not going to go over all the numbers, but it's a class that a career that they can get at the community college. Let's say you have a student that took nurse aid, and this has happened a lot. Nope, it's not for me. This is not for me, because I guarantee you, some things, once they see it, they're going to be like, oh, I'm done. So, but they still want to be in healthcare. Why not start steering them to other areas of healthcare. 2 years for clinical laboratory, they get paid very well. They can work for a hospital. They could work for a private lab, um, such as Abbott or some of the other ones. Respiratory therapy. Now, this isn't something I'd want to do because I don't like sputum. I don't like spit. I don't like it. But some students it's a very involved uh, position. A lot of them work in EDs. They work all throughout the hospital, but there's some certain parts of the hospital that has more activity than others. But these are the people that intubate, and they work well work with the nurses in critical care. Pharmacy technicians. That would be for students that think they want to be a pharmacist, but they could do that. It's kind of like nurse aid. You think you want to be a nurse? Start at this step to see if this is something you want to do. It gives them an opportunity to actually see how a pharmacy works, what's involved. Is it something I want to do? Registered nurse, again, plenty of opportunities out there. A lot of openings in either of these positions. I put the Star Jobs link for NC Careers. You're going to see a lot of other careers that will be booming, and students will be able to still have an impact in healthcare. Did you know that healthcare uses more than just people at the bedside? They have computer people there. They have their own department for computer. They do supplies. We even have a budget department. We have an education department, and it's not only for nurses. It's for anyone, different areas of the hospital. So there are many opportunities out there in healthcare. So I want to talk about HOSA, which is our CTSO, Korean Technical Student Organization. We promote career opportunities, promote leadership development, promote motivation and recognition. We also have included middle school, secondary, and post-secondary. Jennifer Epperson is our executive director. This is her first year. And then I put the website for NC HOSA. But I want to encourage you as CDCs, counselors, guidance counselor, to attend our state leadership conference, which is April 12th through the 15th, and it will be at the Corey Center in Greensboro. The competitive events will start on Wednesday, April the 12th. I'm going to tell you, I did not come from high school. I came from a community college, and before I went to DPI, the first time I saw those students at HOSA, I was amazed. My mouth literally dropped at the professionalism, the way they were dressed, the way they would act. I even got on the elevator. 2 students came on. One young lady was in the corner, really, really quiet. The other young lady said, "Hi, my name is so-and-so. My teacher told me if I saw someone in the elevator to speak to them, talk to them." And she did it. So we would love to have you come to HOSA to be a judge, and you get the training. If you sign up as a judge, you're trained. You even get free breakfast, free lunch, free breakfast and lunch. So they'll feed you so long as you're judging. You get to meet, you may even see people that you had not seen for years, but just to see what the students do and to witness some of the competitive events. If you are interested in participating in HOSA as a judge, you can contact myself or Melissa, or you can contact Jennifer from the email. So if you have any questions, Amy, are there any questions in the chat?
Barbara, I'm not seeing anything, but I did put the link in there again, the Microsoft form for any.
Okay.
And Melissa, just so you know, put in the chat earlier, DHSR is Department of Health Science Regulation, Health Service rather, Regulation, and they're the regulating body for nurse aid.
Yes.
Any questions can go in the chat now.
Melissa, do you have anything you want to add?
I will just as you said, Barbara, encourage. The best way to know what nurse aid, what health science is all about is to come to State Leadership Conference and to see HOSA in action. It helps you understand, because let's be honest, everyone's really busy, and CIMCs, CDCs, counselors, you might not get to go into the classroom and see what that teacher is actually teaching those students. But if you come to HOSA, you're going to see what those students have learned, and it's eye-opening. So I encourage you to come to judge a competition, see what your students are learning, and take that back.
So this is the attendance checkout. And we appreciate the opportunity to be in front of you guys. I've always said I need to be in front of the counselors and the CDCs. Follow us on the social medias, and there they are. Again, thank you. This is how you get in contact with Melissa and myself, or you can ask your health science teacher. They know how to find us. But I'll talk to you guys anytime. If you have any questions, concerns, anything, please let me know. Somebody wants to see the checkout, I think. I saw it flashing. Is that what they wanted? Yes, that was it. Okay. And that completes our presentation.
Thank you, everybody.
Barbara and Melissa, thank you so very much for this information on the health science programs and pathways and detailed information due to your experiences, professional. You are both impressive ladies and I appreciate your time. We appreciate your time. You can stop the record button now, Barbara.
Okay, let me stop sharing. That's the only way I can see it.